Assalamu alaikum. Hello everyone. This is Hoor Ameen, a fourth year medical student. This video will be a quick review of section 9 of the central nervous system chapter, which is about brain injuries. This video is just to highlight the keywords and the important things that you need to memorize for the exam. So let's start with traumatic brain injuries. So traumatic brain injuries can happen at the site of the impact and the opposite side. It can lead to either a concussion or a contusion. Concussion, اللي هي الارتجاج, is only a temporary alteration of the brain function, which can lead to temporary signs and symptoms like dizziness and loss of consciousness. However, contusion, اللي هي الكدمة, is a permanent neurological damage. So this can be due to repetitive concussions. Now, sometimes with traumatic brain injuries, some vessels might be injured in some species, like the subdural and subarachnoid spaces, leading to hemorrhage there, and these are fatal conditions that need to be treated rapidly. Sometimes this hemorrhage might lead to an increase in the intracranial pressure. So this increase in intracranial pressure will cause the brainstem to slip inferiorly, because we are applying pressure on the brainstem. So if it does, it will lead to a loss of control of the blood pressure, heart rate, and respiration. This is important. Remember that the brainstem is the one that has centers for blood pressure, heart rate, and respiration regulation. So if it was damaged, it can lead to death spontaneously. So remember this. Traumatic brain injuries or accidents can cause brain swelling and cerebral edema. So we have concussion, contusion, hemorrhage, and brainstem injuries. Then moving to cerebrovascular accidents or the stroke. We said that the stroke, اللي هي السكتة الدماغية, means that we have a blockage of blood circulation to the brain, leading to brain ischemia. So ischemia is the shortage of blood, the deprivation of blood. So what's the most common cause of brain ischemia? It's the blood clot within the cerebral artery. Memorize this. Now CVA can cause hemiplegia, which is paralysis, شلل نصفي. طبعا it is the opposite side. So if we have a brain injury on the right side, it will lead to a left hemiplegia and vice versa. Also, it may lead to disruption of the sensory functions, leading to problems with understanding and vocalizing speech. It can also lead to motor deficits, so patients will have muscle contracture if they were not treated with physical therapy as early as possible. Other than stroke, we have the transient ischemic attack. This is the mini stroke. The transient ischemic attack is the mini stroke. Here it's a reversible, Here there's a reversible damage only, reversible cerebral ischemia, and it causes temporary numbness, paralysis, or impaired speech. So stroke is permanent, while transient ischemic attack is reversible. Remember, we said that the stroke, there's a clot that blocks the whole artery. So there is total blockage of blood. However, in transient ischemic attack, it's only a small clot here that doesn't block the artery completely. However, less blood will reach the tributaries here. That's why there will be short temporary signs and symptoms. Now with strokes, the brain will be ischemic, so it dies. When it dies, the neurons within the brain will start releasing some substances and neurotransmitters. One of the most important things or neurotransmitters that we need to memorize is the glutamate. Why is it important? Because the glutamate is an excitotoxin. It means that it's a substance that causes excitation. So with excitation, if the glutamate was released excessively without control, it will lead to an uncontrollable excitation of the surrounding cells, leading to death. So again, glutamate, if we have neuronal death, it will lead to a release of glutamate, which will cause overexcitation of the surrounding cells, leading to death. Glutamate is important for learning and memory. How to treat this condition? If we have a clot here, we want to dissolve it. So we dissolve it by tissue plasminogen activator. Again, this is important to memorize. Then we have the degenerative diseases. We start with Alzheimer's disease. This is a progressive degenerative disease of the brain that ultimately results in dementia. What are the clinical features of Alzheimer's disease? It causes memory loss, short attention span, disorientation, and language impairment. We have two important hallmarks that we need to memorize in Alzheimer's disease. So if in the exam they will ask you about it, we have senile plaques or beta amyloid plaques, and we have neurofibrillary tangles. Remember, the senile plaques are extracellular, and they happen due to a cleavage of the amyloid precursor protein. It was a disrupted cleavage that leads to aggregation of beta amyloid structures which are insoluble. So they aggregate and form these plaques extracellularly, yani between the neurons. Within the neurons, we have the neurofibrillary tangles. These are intracellular tangles, are composed of tau proteins. So the tau proteins are found within the neurons, but here they aggregate and grab each other, leading to formation of these tangles. And the number of tangles correlate with the cognitive impairment. The more we have, the more the cognitive impairment will be. What are the most important brain areas affected in Alzheimer's disease? These are hippocampus, basal forebrain, and association areas of the cortex. And these areas are mostly important for memory and thinking. That's why these functions are impaired in Alzheimer's disease patients. Also, we said that Alzheimer's disease affects acetylcholine releasing neurons. So in this case, if you want to treat patients or delay the cognitive impairment in Alzheimer's disease patients, we can use drugs that inhibit the breakdown of acetylcholine. Also, we have Parkinson's disease. Again, it's a degenerative disorder, but here the degeneration happens at the level of the dopamine releasing neurons of the substantia nigra. This is a basal nuclei or basal nucleus. So here we will have degeneration of the dopamine releasing neurons. So we have low dopamine, and in this case we will have a hypokinetic feature. It's a hypokinetic disease. So what are the clinical features of Parkinson's? There is persistent tremor at rest. It relieves with movement. We have stooped posture, shuffling gait, the short stoppage gait. We have stiff facial expression or masked face. We have slow initiation and execution of movements. So everything is slow here in Parkinson's disease. So what do we do here? Because we have deficiency of dopamine, we will treat by L-Dopa and any drug that inhibits the breakdown of dopamine. Remember, that was good for the early stages of the disease. However, later in the disease, because we will have degeneration of the neurons, we will not benefit from dopamine, so we will use the deep brain stimulation. And they are working for future therapy or gene therapy to give patients a treatment that leads to an increase or a release of GABA neurotransmitter, which is an inhibiting neurotransmitter that will inhibit the tremors effects here, or the excessive brain stimulation. Huntington disease is the opposite of Parkinson's. Parkinson's is hypokinetic, Huntington is hyperkinetic. Again, what did we say about Huntington? It's fatal, it's hereditary, that's why we can see it in middle-aged people. It happens also at the level of the basal nucleus, but what happens here is the accumulation of Huntington protein. This will lead to degeneration of the basal nuclei and later on the cerebral cortex. So in the Parkinson's we have low dopamine, here we have high Huntington protein. This is again a hyperkinetic disease. So what do we have? The clinical features. We have chorea. Chorea is the dance-like movements. We have wild, jerky, continuous flapping movements. And later on, there will be mental deterioration. So since it's a hyperkinetic disease, we will treat it by blocking dopamine instead of giving dopamine, as in Parkinson's. So these are the keywords important for these diseases. If you memorize them, you'll be good for the exam, inshallah. We hope it was good and summarized well. If you have any questions, let me know, and good luck. Thank you for watching.